Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers the RN nursing care for schools and other healthcare facilities. By the end of this lesson, you should be able to discuss the professional standards expected of school nurses. You should be able to differentiate between the many roles and functions of school nurses. You should be able to describe the different variations of school health services in coordinated health programs, and you should be able to assess the nursing care given in schools in terms of primary, secondary, and tertiary levels of prevention. You should be able to identify future trends in school nurses and identify two or more facilities that RNs work within community settings. The history of school nursing began with the earliest efforts of nurses to care for people in the community. The need for school nurses was immediately recognized by community care healthcare members, and school nurses provide health care for communities and families through the school system. In the early 1900s, school nurses screened children for infectious diseases. By 2002, school nurses provide direct care, health education, counseling, case management, and community health outreach opportunities. There's more to what a school nurse does than what meets the eye. School nurses have varying educational levels depending on state laws. The U.S. government supports school based healthcare centers, school link programs, and a full service of school based health centers. The Healthy People 2020 also serves as a guide to enhance school nursing as well. What are the nurses doing in the schools? Let's expand on that a little bit more. School nurses give care to children as direct caregivers, that's one example, as educators, as counselors, as consultants, and as case managers. They must coordinate the health care of many students in the schools with the health care that the children are receiving from their own primary health care providers. So school nurses must also be able to understand what's going on with their enrolled student and what the doctor has prescribed. In the Healthy People 2020 objective, ECBP 5 states that there should be one nurse for every 750 children in each school. That's a big goal. It sounds easy, but imagine having to take care of 750 individuals under your care. Most schools have not reached this objective yet. In 2006, approximately 40% of the nation's schools met this standard. The new objective is that 44.7% of the country's elementary, middle, junior high, and senior high schools have this many nurses. We haven't gotten there yet. Having fewer nurses in the schools means that the nurses are expected to perform many different functions and wear many different hats. It is therefore possible that they may not be able to get all the comprehensive care stuff that they need to do for one student. In 2003, the National Association of School Nurses adopted a resolution recommending that there be a school nurse at each school at all times. Imagine that. There are actually school nurses that are managing a population of students that are not based in the same location as they are. So this is why this recommendation was made. The recommendation was based on requirements of Individuals with Disability Act and the CDC requirements that are also mandating what should be happening as far as school health services are concerned. Let us now expand more on what we mean by school health services. The National Association of School Nurses is the professional organization for school nurses. And what are these nurses doing? The nurses must be able to meet the following criteria. They should be able to develop a school health policies and procedures. They have to have that. They should be able to evaluate their own nursing practice as far as from a nurse practice act standpoint and how they're meeting those student needs. They should be able to keep up with the nursing practice and keep up with the required educational responsibilities of an RN within their state. They should be able to interact with interdisciplinary healthcare team. They should be able to speak the language of healthcare. They are the go-to person in that school that speaks that language. They should be able to ensure confidentiality with providing healthcare services and talking to healthcare providers. They should be able to consult with others to provide complete, comprehensive care for each child enrolled in that school. They should be able to apply research findings into practice in advance their policies and procedures to match what the national guidelines are. They should be able to ensure the safety of the children, including when their care is delegated to other school personnel. What does that mean? An example, a diabetic child going on a field trip with a school driver, a bus driver, and a teacher. If that child is under diabetic care within the school system, the school nurse is going to have to ensure that the patient's safely taken care of while they're gone. Having good communication skills is important for a school nurse. Managing a school health program effectively is important, and teaching others about wellness. It's a pretty comprehensive deal. Let's talk about the different levels of prevention that are happening in the school system. We'll first talk about primary prevention. Providing health promotion and education to prevent childhood injuries and substance abuse is a very big part of what a school nurse does. The school nurse will monitor the children for all of their state mandated immunizations for school entry. So imagine 750 students and however many mandated immunizations are required before they enter the school. It is a big job. Secondary prevention measures involve screening kids for illnesses and providing direct nursing care. The school nurses develop plans for care and emergency care for if there was ever a need. They also give medications to children in the school that must be monitored carefully and collaborated carefully with the healthcare provider and the parents to make sure they're preventing errors. The school nurses are mandated to tell the authorities about any suspected cases of child abuse and neglect. It's a big job. The another prevention is tertiary prevention, including caring for kids with long-term health care needs. This number of kids keep increasing in the school, so the school nurse is also responsible for that, including asthma, disabling conditions are common in that. School nurses carry out catheterizations, suctioning, GI fittings, and other skills, nursing skills that are required in the school within the school system. Your textbook expands on some of the legal and ethical considerations that school nurses face. Some of the ethical dilemmas you may think about in schools are related to women's health care and some reproductive health issues, contraceptives, and pregnancy care. All those different things that are happening in the schools also require legal and ethical considerations as well. Some of the nurses using privacy regulations, use of the internet to help communicate with children and families also presents itself with a slew of legal and ethical considerations. That's an overview of RNs in the schools. There are RNs in other institutions and facilities. Examples include correctional facilities, colleges and universities, and any other aspect of community nursing. There are other aspects such as forensic nursing. Forensic nursing synthesizes the psychosocial and spiritual aspects of nursing care with expert understanding on forensic science and the criminal justice process. Forensic nursing is distinguished as its own unique body knowledge within the community health arena, and it has its own practice arenas in client population that's reached. Thank you for listening in to this lesson. I hope you have enjoyed this overview of RNs in schools and other facilities. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.